हुन्छ
Really? So
हजुर
we are just going to do for half an hour. And one of the
हजुर
things is in your tomorrow when you have an interview, make
हजुर
sure your camera angles are correct. Don't
ओके
try to give your interview through a mobile. Are you using a mobile or laptop?
एट द मोमेन्ट आइएम युजिङ अ मोबाइल फोन दाइ
Okay, like tomorrow,
हजुर
be conscious because when you use a mobile phone, the screen will
हजुर
be half.
ए
The
ओके ओके
full screen. Okay,
हजुर
and
हजुर
when you go for an interview, make sure that your camera angles are right. Yeah. Keep yourself in the middle. Try to dress professionally. Okay. Make sure you wear like a proper kind of t-shirt. You look
अलराइट
professional. Don't try to look casual, right?
अलराइट
If you
हजुर
try to look casual, then they think that okay, this person is not serious for this interview.
हुन्छ दाइ
Okay. So have you discussed with Ozzy what are the potential questions that might ask?
Not really that I called him, but he didn't pick up the phone. I think he might be sleeping.
I think
He
he's
might
got a
have a
flight
night
today.
duty.
I think he's got a flight today.
Oh, to Australia.
Yeah.
Oh my gosh, I didn't know that.
So the list of the question that might be asked to you is, they might ask you, take me through your CV and tell me why do you think you are suitable for this job. Okay.
Yes,
They will also ask you about your psychiatric experience, what kind of psychiatric experience you have. Yeah.
yes,
And since that Wally patient is general adult ward,
yeah.
okay, they will ask you about some scenarios which are very common, right?
Mm-hmm.
Um, so some of the scenarios they will ask you is they will ask you, for example, do you know how to do risk assessment? If you are seeing a violent patient, what are the steps that you will take forward? Yeah.
Yes.
They will also ask you about, about different mental health condition.
Mm-hmm.
Okay. They will ask you about your history taking skills. Okay. They will ask you what are your weakness, what are your strength, and how it is
So
relevant for your
yeah.
psychiatric experience.
So they about different mental health conditions. So does it mean to say like EUPD and general
No, no.
anxiety disorders?
Um, no, they will generally ask you about, tell me about case, mental health case that you have seen which had made a very deep impact in the way you practice psychiatry. Or you
Okay.
see psychiatry. Okay, so it will be more like a general. They won't ask you about it. Tell me about paranoid schizophrenia, this and that.
Oh, all right.
Okay, and they might ask you about on-call scenario. On-call scenario is, for example, if you have like two or three calls from the nursing team, how are you going to prioritize the case?
Okay.
Okay, so since in this interview, I don't think you'll be the only one. They might have five or six more candidates.
Okay.
So the interview will be very short and brief. And you need to learn the art how to just a second. You need to learn the how in a limited time how to make a big impact.
Okay.
Does that make sense?
Yeah, yeah,
Okay.
they.
So is it all right if we can practice a few questions and you try to answer, and I'll try to
Mm-hmm.
give you a feedback. How you can make some changes. Is that all
Sure,
right?
sure, they. Yeah,
Yeah.
definitely.
So the first question I'm going to ask is, please introduce yourself and tell me about your psychiatric experience and why do you think you might be suitable for this job?
All right. Well, first of all, thank you for this interview opportunity. So, regarding my introduction, my name is Saurabh Shrestha. I would like to describe myself as a person who is committed and dedicated to become a psychiatric consultant in coming days. Um, I'm a hard worker, honest, and I take responsibility of whatever job I do. Um, Regarding my qualification, I'm an MBBS graduate. I graduated from Chiton Medical College in 2020 from Nepal. Soon after my graduation, I did 1 year of internship, which is equivalent to Foundation Year 1 in the UK. During that time, I rotated through different department where I gained overview of the various physical health cases. and learn how to manage them and approach them. After that, I did worked as a medical officer in multi-specialty hospital, and then I shifted to community, a government community hospital. Over there, I looked after various outpatient cases, including mental health cases, for which I referred them to a relevant psychiatric specialty. After that, I came to the UK. I did my PLAB exams and got my GMC registration. And I was fortunate to get a clinical attachment in Royal Blackburn Hospital in Horsewood Ward. I did the attachment under Dr. Dioman Gurung. And during that time, I had a very good opportunity to get experience and exposure to various psychiatric cases. First of all, I got a very good overview of NHS mental health services over there. And I also saw how a mental health service is run, reflecting their core value of being showing care, showing respect, and working together as a team. Over there, I participated in various meetings such as MDT meeting, best interest meeting, discharge CPA, and I observed how everyone worked together to come up with a common plan, a common approach for the best interest of the patient. I also seen different reviews from the different consultants and junior doctor, and I saw how they communicate with the patient, make them open up with the problem, and try to address them in the best possible way. And I also, during that time, I shadowed a resident doctor, and I learned about the general job duties and responsibilities of a junior doctor. And I also did on-call shadowing, where I learned how different cases might come while being in on call and how to resolve them. So these are the things that I would like to put myself on the table, and I feel that this my experience and exposure make me a suitable candidate for the job.
Are you done?
Uh, yeah,
Okay, take a deep breath. Okay, deep breath. Okay. So when you reflect back, okay,
yeah,
yeah, you try to make an attempt to, show the different kind of, different things that you can offer. Okay, but I'm not just going to focus on the things that you are already good. I'm just going to
yeah,
focus on the things that you can do it better.
sure,
Does
sure
that make
thing.
sense? Because the
Yeah,
time duration is just like a very short. So when you answer this question, if I'm sitting on the panel on the other side, there are certain things that I would look for. Okay, I'm not bothered about your qualification, where you qualified, your journey. I'm not interested in all of those things. Okay, I'm
mm,
more interested in the job specification for the job role that I'm looking for. Does this person have read the job specification or not?
all right.
Does that make sense? In the
Yeah,
job specification, they are looking for a trust grade doctor who is a GMC registered, who has got experience in psychiatry, and who is approachable and know the framework of Lancashire care and how the Lancashire, the policies of Lancashire care. That's the only thing that I look for.
all right. Okay.
Does that make
That's
sense?
it.
So you
Yeah,
provided too much of information, but some of the information I really don't need it. Okay.
all right.
If I were you, there are some of the things that I could have highlighted. Rather than going on a long monologue, just try to keep it in a very short and simple. And say, for example, in this case, the way I would have approached is I would have said, hi, I'm Dr. Saurabh Shrestha. Thank you very much for providing this opportunity. I had a chance to look at the personal specification, and
Mm-hmm.
I clearly believe that I have all the requirement to apply for this job. I'm a GMC registered doctor, full GMC registered doctor. Okay. Um, I trained in Nepal and I've got at least 4 years of experience working as a trust grade doctor. I also had the opportunity to work in Lancashire, and thank you very much, Lancashire, for providing in my 2 months experience in Lancashire. This experience provided me overall kind of idea about what is expected in a trust grade job.
Mm-hmm.
This experience which I had, it helped me to work in the MDT kind of setting. It helped me to work. I was fortunate enough to do a placement in old age, which I believe the inpatient setting is quite similar to all the Wally Center. Okay, but
Hmm.
I'm aware the Wally Center is a general adult. Also had an opportunity to work in memory clinic. During my experience in the old age 2 months, I was able to see how the CPA are organized, professional meetings are organized. I'm also aware of the roles and responsibility of a junior trust grade doctor because I was able to shadow resident doctors. I'm also fully aware of the electronic system that they use in Lancashire, which is RIO and EPMA. Also managed to do an audit, and I'm fully aware that the quality improvement, the trust that we care for the patients, which is in the heart of this trust, which follow the GMC guidelines. And if I'm provided the job, I can fully bring up all of the qualities which are required for the job. And I would also take this opportunity to polish my skills further. And I hope the job will provide me this opportunity to enhance my skills. Thank you, Nandini.
Dami. Hazir.
So, so just try to keep the things that they want to listen. They're not
Hmm.
interested in what you have to say. Just try to sell the product. For example, if I'm selling a soap, okay,
Hmm.
and if the person wants a soap to wash the clothes, okay,
Yeah.
just highlight this soap will make your clothes brighter, it will last longer. Don't try to say the soap you can also use for motorbike, you can also use to
Mm.
wash your dishes, wash your this. So too much of information, just try to narrow it down and try to squeeze it and try to show that you are already in the system, you know
All
the
right.
system. Okay, so they don't need to retrain you because you have seen the system.
Hmm.
Does that make sense?
Yeah, they.
Okay, so in this try to focus on that. Okay,
Okay, okay.
so the next question they will ask is, if you have got a patient on the ward who is a bit violent, okay, and the nursing staff have approached you, how do you think you are able to manage this case?
All right. First of all, thank you so much for the question. Um, well, if a nursing staff comes to me for a patient who is violent on the bed, so first of all, I would like to ask for some information about the patient with the nursing staff, like how did that happen, what could have been the trigger, how is he doing right now, to know the background of the situation. Then I'll quickly go and assess his clinical record to understand his psychiatric background, or if such incident had happened before, how it was managed. Then after that, I'll go and approach the patient. First of all, I'll make sure that I'm in a safe place, and I'll also take some colleague with me, so and make sure that they are also on a safe side. And I'll go and quickly scan the room and try to make sure that the patient is also on a safer side. Then I'll approach him with a calm and composed manner, with a reflective approach, how about his mental state at the moment. And I'll try to verbally escalate things, being on a safer side. uh, uh, I'll try to calm him down and contain him. If this doesn't work, I'll try my best to contain him, or de-escalate the situation. And if it doesn't work, I'll get some help from my colleague. And if also that doesn't help, then definitely we have other options, such as rapid tranquilization or seclusion options. So I'll go with that.
Okay. So in
Thank
your
you.
question, you know the basics of how the things are done. Okay.
Yeah.
But in your question, what it shows is you haven't done it. Does that make sense?
Yeah.
Okay. So even if you have not done it, you need to show the confidence that if the situation arises, you are capable of handling the situation.
Mm.
Does that make sense?
Okay. Yeah.
So if this question is asked to you, and if I was in your position, I would say, okay, thank you very much for asking this question. When I had an experience in LCFT, I also managed to shadow uh, shadow a resident doctors during the on-call, and I had encountered similar situation. So from my learning from that experiences, before nursing staff escalate these things, my job is to gather as much information as possible. Okay.
Mhm.
After the nursing staff have given me the information I would gather is SPOT, situation, background, assessment, recommendation. Okay.
Yes.
And I will also provide a bit of reassurance to the nursing staff. Okay. Then I will take some time to look at the Rio background. Okay. I'll check all the risk factors. I'll check the mental history and everything. When I come and before I assess the patient, I will also have a chat with the nursing staff face to face, just to see, how the patient's presentation has been the whole day.
Mm.
Has there been any triggers? Has there been any kind of changes in the presentation? Okay. After that, I will make sure the nursing staff can provide me a suitable place or room where I can review the patient. Okay. And
Mhm.
if there's a history of risk to self, to others, I will also make sure that the place where I'm seeing is safe enough. I will also carry alarm bleep with me. If the
Okay.
situation arises, I can call the staff. So I will make sure the arrangement of the room is safe. So I'll try to sit near the door exit where I can exit from the door.
Mhm.
When I approach the patient, my communication, I need to be aware of my communication skills. Okay. I need to be sensitive in way I approach the question. So the first port of contact is I'm well aware of verbal de-escalation. It's not escalation, de-escalation.
Yeah, Azil. Yeah.
Escalation is you're just going to go up.
Yeah, Azil.
Escalation is,
Yes.
okay. Uh, if it's not managed by verbal de-escalation, I'll try to see whether I can have a support from the nursing staff. Okay. And if the situation is not managed, what I will do is I'll go back and look at the medication chart. When did the patient had some rapid trank, okay? And I'll be fully aware of the trust rapid trank policy. Okay, I will offer oral. If not, then the rapid trying have to be administered. But for that, I also need to check the confidence of my staff. After the rapid trying is utilized, then I'm also aware that the patient's physical health needs to be taken, reviewed in an hour's time. This is how I'm going to approach. After having similar cases like this, I'm also aware that I need to discuss these cases in my supervision. I will also reflect on this case and I'll see how I can learn and polish my skills moving forward. Okay, so when you give an answer, make sure that from your answer, it seems like you are doing those things in the practical sense.
All right. Okay. Yeah.
Does that make sense?
Yeah.
So
Yeah.
the answer is not finished until and unless you have supervision, reflected, learn, and what you are going to do next. Okay.
Yeah. I'll
If it
put
is an
that in my
on-call
course.
if it is an on-call setting, after that, if I'm struggling, I'm always aware that I can, get an advice from a middle grade doctor. Okay. So are you aware how to answer this?
Yeah. Yeah.
Okay. They might
Okay.
also ask you about, what are your strengths and weaknesses.
Strength. Okay. So regarding my strength and in relations with the psychiatry job role, I would say I'm a very good listener. So I would like to explain it with the situation that we had while during my clinical attachment in Lancashire Trust. So yeah, Lancashire Trust. So while performing the mental state examination, I under the supervision of different consultant, I got a very good feedback that I do listen. I do. I'm very patient with the listening, and I give time for the patient to process themselves and listen their concern. I was also very reflective of their mood. By that way, they which made them comfortable to continue with a good communication. With a good communication, yeah, and by that way, they were able to open up their things. So I was able to make a full conversations, and I was to do a very good mental state examination. They, I think, yeah.
Okay, when you answer this, there are a couple of things that you need to touch. Okay, when you talk
Oh,
about strength, okay, you need to highlight that you are a team player.
okay.
Team player, communication, you are able to listen. Okay, give, and your approach is more patient centered.
All
So,
right.
you're willing to listen. You are able to make the patient comfortable. In the strength, I will also recommend talk about your cultural sensitivity. you're also aware that, different, being myself from a different cultural background, I'm aware that, this can be one of my weakness, but I'm willing to learn the culture of it as well as polish it. And it can be only done by the process of continuous feedback from my supervisor.
Mhm.
So you can also talk about, your strength is you are able to adapt, okay? You are able to listen, and you also have a bit of honesty and humility, you know, to work with a team, okay?
So we so we have to elaborate like different strength, or do we need to focus in one or?
No, no, you can tell about different, and you can say, I want to highlight this by giving an example during my clinical placement, where I was asked by my supervisor to review a patient under his guidelines. Okay, and during the placement, the patient was not willing to open up much, so I provided more time for the patient. Rather than focusing on the symptoms, I focused on the patient and center. I had some curiosity, okay,
Mhm.
to know more about it. I also have the humbleness to listen. Okay, so by providing this kind of like suitable environment or background for the patient, patient felt comfortable to open up. And I've also realized and reflected that patients who are admitted on the ward, sometimes it's a very, challenging and difficult situation for them, and they might find it difficult to trust people in a sensitive time.
Excellent.
So I've realized that, these are some of the assets that I have, which can be a valuable thing for my psychiatric career moving ahead.
All
Okay.
right. हजुर.
मलाई विकनेसमा चाहिँ मेरो पास्टमा चाहिँ मलाई विकनेस सोद्धाखेरि चाहिँ म चाहिँ के भन्नाले आम अ भेरी एक्सट्रोभर्ट पर्सन sometimes I tend to say things without thinking. So I have reflected back that, I need to give a pause, okay? And I need to learn from my experience. I've also realized that, different people come with different personality and
Mhm.
strength and weakness. I don't consider this as my weakness, but I would say that, there are some areas that I need to work out. And I believe that, reflection, supervision, and experience are some of the things that I can use moving forward to enhance overcome this, my weakness. Okay.
Reflection, yeah.
So,
Okay, sir.
yeah. Uh,
Okay.
Other than
So can
that,
yeah, हजुर.
mm,
Can I
well,
say that like listening, I can say my strength is that I'm a good listener, but in relation with the psychiatry, I would say listening is my weakness as well, because like since I've worked in physical health setting previously, I used to listen and give more time to the patient. However, what I've realized is sometimes listening too much can escalate things in psychiatry, and we should know uh, de
balance it
how
out.
how to balance it
Balance.
out and leave the situation uh, to prevent arousal or aggression.
Um,
And I would like to.
when you give an answer, one of the things that one of the difficulties as we IMG doctors have is, sometimes when we get confused, we tend to use a very heavy words.
Mhm.
Arousal, agitation. Arousal
Yeah,
can mean a different thing to different people. You know,
all right.
arousal is it a sexual arousal?
No, no,
Okay,
I
so
need to.
when you give an answer, try to keep it very simple,
Okay.
short sentence. Okay,
Mm-hmm.
and I've also realized that, when you speak normally, your pace is all right. But when you're put on the spot, you tend to you speed your pacing
Rest.
too
Yeah, yeah.
much. Okay? So try to take a deep breath, relax position, composed. And the
All
thing
right.
is, don't put too much of pressure that you need to get the job. The only thing that you have got in control is the way you answer. You don't have control in the result.
Yeah, exactly.
Okay. So, and the other thing is also work on your confidence.
All
You
right.
just realize this. You know what to say, but
Mm-hmm.
sometimes there's a bit of like doubt whether I'm saying this thing right or wrong. So the confidence is missing. Does that make
All
sense?
right. Yeah.
Okay. So when you go for an interview, go with the attitude that, I'm the best doctor. Okay,
Yeah.
there's no any doctor better than me. So have that confidence. So if you have that confidence, it shows in your vocal, your face, your everything. And when you give an interview, also try to have some, welcoming posture, smile.
All
Okay,
right.
don't try to be too much serious.
Okay.
Okay,
Excellent. Excellent.
and it's just a resident trust grade job. So the questions that they might ask is not very detailed questions.
Okay.
Okay. Sometimes they might ask you about, do you know about any section? So I think section bit, which I've already covered before. Section
Yes.
2, section 3, you only have 5 2. Okay. And
Mm-hmm.
they might ask about, what are the requirement of section 2? So you can say, mental disorder,
Okay.
nature, degree, risk to self, risk to others. Then you can
Mm-hmm.
also say about capacity, insight. Okay, and I've covered about mental capacity. They might ask you about capacity.
So mental capacity, regarding mental capacity, I could just explain those four component, right?
Before
Like to
that,
have, yeah.
before that, mental capacity is a time and task specific.
Okay.
Okay. The other thing is when you are doing mental capacity, especially in the psychiatric setting, the mental disorder can impact the mental capacity. So I will quickly do the mental state examination just to rule out the
Mhm.
possibility of impact of mental disorder with a capacity. Okay.
Mental disorder.
And when you
Yes.
talk about capacity, understand, retain, weigh the pros and cons, and communicate. Okay. So they will only ask you about this. Okay. So how
All
do you
right.
feel? I don't think they will ask you any question beyond this.
All right. Okay, then I'll do a review and I'll
Yeah.
practice as much as I can.
Yeah. And I'll send you this video. So at least you can
Sure.
also see your own body language. Your
Yeah.
and right now what I've noticed is you have got a bit of tense body.
Yeah, exactly. Like it's just tomorrow and it came very suddenly. So
You need to have, like you have already done 2 months with me. Okay.
yeah,
So
and
you need to have the confidence that, even if they ask you today, I can answer. So have that confidence
yeah, sure. The
because you have done attachment with me.
yeah, yeah,
So
I
you
will.
need to have the confidence that, I can deal with anything.
Yeah, sure.
Okay. And even if, and make sure that, they will ask, have you got any question in the end? You can say that,
Hmm.
is it possible to have a feedback
All
of
right.
this? Okay. And what I can learn from this. Okay.
Okay.
Okay. I think my time is all up. Okay. Thank you very much.
Sure.
I'll
Then.
send you this. Yeah. All the best for
All
tomorrow.
right. Thank you so much, Dai. Thank you.
Bye.
Thank you. I appreciate it.